Have you ever wondered what it feels like to have your strongest tendon suddenly snap? Imagine the excruciating pain and the immediate loss of mobility. This is the reality for those who experience an Achilles tendon rupture. The Achilles tendon, named after the legendary Greek hero, is the largest and strongest tendon in the human body. It connects the calf muscles to the heel bone and plays a crucial role in walking, running, and jumping. An Achilles tendon rupture is a complete or partial tear of this important tendon. This injury can be devastating, significantly impacting a person's mobility and quality of life. It often occurs suddenly and can affect anyone, from professional athletes to weekend warriors. The most common cause of an Achilles tendon rupture is a sudden increase in stress on the tendon. This can happen during sports activities that involve quick starts and stops or sudden changes in direction. Other risk factors include age, as the tendon weakens over time, certain medications like antibiotics, and pre-existing tendon problems. The most common symptom of an Achilles tendon rupture is a sudden, sharp pain in the back of the ankle or calf, often described as feeling like being kicked or shot in the back of the leg. You might hear a popping or snapping sound at the time of injury. Walking becomes difficult, and you may be unable to stand on your toes on the affected leg. Diagnosis typically involves a physical examination. A doctor might perform a Thompson test, squeezing the calf muscle to see if it causes the foot to point. If the foot doesn't move, it could indicate an Achilles rupture. In some cases, imaging tests like an MRI or ultrasound may be used to confirm the diagnosis. Treatment for an Achilles tendon rupture can be either surgical or non-surgical. The choice depends on factors such as the patient's age, activity level, and the severity of the rupture. Surgery involves stitching the torn tendon back together and is often recommended for younger, more active individuals. Non-surgical treatment involves wearing a cast or boot to immobilize the ankle and allow the tendon to heal on its own. Recovery from an Achilles tendon rupture is a lengthy process, typically taking several months of rehabilitation, including physical therapy exercises to regain strength and flexibility. Patience is key during this time, as rushing the recovery process can lead to re-injury. To reduce your risk of an Achilles tendon rupture, it's important to warm up properly before exercise. Gradually increase the intensity of your workouts and wear appropriate footwear. Strengthening exercises for the calf muscles can also help protect the Achilles tendon. An Achilles tendon rupture is a serious injury, but with proper treatment and rehabilitation, most people can return to their normal activities. If you suspect you've injured your Achilles tendon, it's crucial to seek medical attention promptly. Remember, taking care of your tendons is an important part of maintaining your overall health and mobility. Let's recap the key points about Achilles tendon ruptures. First, it's a serious injury that occurs when the largest and strongest tendon in your body tears, often during sudden, intense physical activity. The main symptoms include a sharp pain in the back of the ankle or calf, often accompanied by a popping sound, and difficulty walking or standing on toes. Diagnosis typically involves a physical examination and possibly imaging tests. Treatment can be surgical or non-surgical, depending on various factors. Recovery is a lengthy process, often taking several months. Remember, prevention is key. Warm up properly, increase workout intensity gradually, and wear appropriate footwear to reduce your risk of this injury. Thank you for watching our video on Achilles tendon ruptures. We hope you found this information helpful and informative. Remember, if you suspect an injury, always consult with a medical professional.